Thank you. As I have stated many, many times, the goal of this select committee is to have a better path forward, to admit to our mistakes, to learn from our mistakes, to correct our mistakes, and to provide accountability for any mistakes that were made, especially if mistakes were made because of political motives or personal motives. Decisions can be made on data, and sometimes there was no data, as everyone has pointed out. But sometimes decisions were made in spite of the data. What were the motives? Were they political? Were they personal? With COVID, many lessons have been learned. Our eyes have been opened to too many things, shamefully, for our nation, that we had so many deficiencies. We talk about PPE. We talk about medications themselves. Our supply chain is reliant on China and other countries. We are not an independent nation when it comes to our supply chain, especially in medicine. Look at your generic medications. Look at our protective equipment. If you'd have told me when I was in Iraq that my protective equipment and my pharmaceuticals as a surgeon there relied on China, an adversary, how did we get here? This is not any one administration. We have done this to ourselves over the last 50 or 60 years. You know, we've learned that not everyone was adhering to standards, even pre-COVID. But COVID opened our eyes to a lot of things. But in some places, standards were being adhered to. And it was mentioned, community rates matter. They do matter. That was an important piece of data for all of us. In many communities, if the community rate was high, it was high in the nursing homes. Is that the only factor? Or was it the fact that maybe some nursing homes weren't adhering to guidelines? You know, we have areas where it may have a high rate in the community, but a lower rate in the nursing homes. And if so, why was that? Ms. Lesko brought that up, the difference between Arizona and New York, where many of the vulnerable people in America happen to live in Arizona. Through this time, we've looked at community rates versus in-school rates. You were safer in school than you were at the grocery store, or better yet, at the liquor store, which was open, yet we kept schools closed, or some did. I look at early on some of the things that we saw, and I learned that one size does not fit all. You know, we had a legitimate fear, and we said, let's go to lockdowns. I get that. But when you keep them up and you tell people not to go to the doctor, that's a problem. Those were decisions that were made as well. I actually had a sheriff in one of my rural counties call me and said, I just want you to know, I had a guy 71 years old. He was scheduled to have his painful hernia repaired. They called him and canceled it. And he took his own life because he was in so much pain. There were no cases in that county at the time. One size does not fit all. One size fits all can be very dangerous. When I look at COVID, I look at it as something that should have united this nation, and instead it divided us. And why? Because it was a presidential political year. That's my opinion. It divided us. Politics took over. We see political organizations having influence on CDC guidelines. That should not be the case. Medicine doesn't deserve that. I see even on this committee, gratitude for vaccines and the vaccine delivery. And I give credit to the vaccine delivery. That was an impressive maneuver, largely provided by our military as far as actual delivery. But I don't hear anybody who's, talking about that from this side, giving kudos to Operation Warp Speed itself. There were mistakes from both sides of the aisle, from every avenue here. Get the politics out of it. We see mandates coming from a politician saying you must get the vaccine. I'm pro-vaccine, but I'm not in a position to say that there may not be some adverse effects for some people and that some people might have questions. A mandate that says you get this or you lose your job and there's no conversation with a physician. What are we doing? I heard time and time again from patients who said, when I talk to you, Dr. Wenstrup, I'm more likely to get the vaccine. But when I'm being told I have to get it by a politician, that's a problem. I just want to be educated, not indoctrinated. There's a huge mistake that we have made in this country. I don't know if any of you have noticed throughout your life, but Americans don't do well with "because I told you so." It doesn't work in America. Listen, I want to thank those who provided testimony for today's hearing. I know it's very personal, and I think it hurts all of us, and I think across both sides of the aisle, that pain is felt. And I want to share with you publicly, that we were going to try to relieve the pain in any way that we can going forward. It's hard to comprehend how, as a society, states implemented mandates that resulted in loved ones dying alone without a single family member there able to say goodbye. It's hard. This hearing and the testimony provided today from those directly affected by the deadly orders enacted in New York, New Jersey, and Pennsylvania is essential to have as we move forward in our investigation into the nursing home policies enacted by state officials and the cover-up that ensued. These orders were more than a mistake. They were a deadly decision. They were medical malpractice by people that don't have a medical degree or a license to practice medicine. I think that we can agree that vaccines were extremely helpful to protect our elderly in nursing homes, but this hearing and this investigation is about the decisions made prior to the development of the vaccine and what actions were taken to avoid culpability for the deaths of thousands of Americans. Today, we heard important testimony that New York Governor Andrew Cuomo loved to blame politics at every opportunity, and then he turned to attacks, belittlement, and name-calling when challenged. He didn't meet with the victims of families or show sympathy to those who were hurting. Instead, he wrote a book. Governor Cuomo had resources at his disposal to protect the vulnerable, and he failed to use them. The Comfort and the Javits Center sat virtually empty. The orders from New York prohibited testing of incoming patients for COVID-19. They mandated that nursing homes and long-term care facilities accept COVID-positive patients. This was directly against the CDC guidance, the CMS guidance, and frankly, common sense. At least common medical sense. In New York, over 10,000 nursing home deaths occurred in the 50 days before Governor Cuomo's mandate was rescinded. Today, we heard concerning testimony regarding the manipulation of data from Governor Cuomo's own office. The Biden Department of Justice chose not to investigate the state orders, nor the ensuing cover-up. We will. Today, we're able to have bipartisan agreement that seniors were failed and too many died. While others blame the Trump administration, the fact is these deadly nursing home policies were not implemented nationwide. Instead, they were developed and enacted by states with honestly, Democrat governors, New York, New Jersey, and Pennsylvania, and against the guidance provided by the Trump administration from CMS and CDC. And that's the key. Not the administration, but the CMS and CDC, which should be agnostic of politics. Those who are responsible for these mandates must be held accountable. The victims and their families deserve transparency and to know who created these must-admit orders, and they deserve the opportunity to hold them accountable. We cannot simply just blame one or the other and move on when families are missing their loved ones and missing the closure that comes with accountability. The Select Subcommittee on the Coronavirus Pandemic will continue to examine the deadly policy decisions surrounding nursing homes, and we will continue to investigate the failed leadership of state officials during the COVID-19 pandemic. And we will continue to provide, as best we can, a path forward for America that is much better for America and has accountability and science behind it. And without objection, all members will have 5 legislative days within which to submit materials and to submit additional written questions for the witnesses, which will be forwarded to the witnesses for their response. And with that, this hearing is adjourned. Thank you, everyone.